And there's a lot of questions out there right now about intermittent fasting, keto, low carb, what's the right thing, eat protein, no protein, eat all the fat. Candace, I'm going to toss that one over to you. Is a keto diet okay? Is intermittent fasting a good way to support our weight loss? What should we be looking for?
Thanks, Brenda. You made some really good points there in that anytime you're looking for an eating pattern, you really need to pay attention to how your body feels. So it's not just about losing weight. It's really about feeling healthy and having energy. So keep that in mind. But let's talk a little bit about two of the fad diets right now. One is intermittent fasting, and there's a couple different varieties of this. Sometimes people will fast 1 or 2 days a week or every other day. But the more common is to extend the overnight fast. So your eating period each day is maybe only 4 to 8 hours long. It's not a calorie restriction diet per se. There's no rules about reducing calories. However, most people just naturally do because their eating window is smaller. So it has been shown to improve the body's insulin levels and cholesterol levels. It also reduces inflammation markers. And all of those things are associated with the big four: type 2 diabetes, obesity, cancer, and heart disease. However, there's not a ton of research, or human research rather, on intermittent fasting. So we don't totally know the long-term effects of this. But there's a lot of research done on Ramadan and different religious fasting holidays that shows that this is pretty safe for most people. It's definitely not recommended for anybody who's pregnant or trying to get pregnant. If you have diabetes, you should proceed with caution. Talk to your dietitian or your doctor before you try this. Certainly not for anybody with a history of eating disorder. That can be really tricky. And then for keto is a very low carb, high fat diet. So about 5% of your calories come from mostly low carb vegetables. And then about 75% of your diet comes from fat. So people eat a lot of fish, eggs, dairy, meat, butter, lard, nuts and seeds. So this one is more concerning to me. The typical diet is really more like 50% carbs. So the foundation of a healthy diet is really fruits, vegetables, whole grains. So anytime you take 50% and cut it down to 5%, you're looking at potential micronutrient deficiencies. And then when you add high fat, that can lead to high blood pressure, cardiovascular disease, any number of conditions. So again, we don't have a lot of long-term research on the effects of keto. We do know that it was developed as kind of a last resort diet for children with drug-resistant epilepsy to control seizures. So I wouldn't recommend following this diet without a good medical reason. Anytime you're cutting out whole food groups, there's room for error. We also find that it can be really tough to follow. People tend to lose weight rapidly on this diet, but then it plateaus. And so I think when you're looking for an eating pattern, you really want to look for something that's sustainable for you long term. It can also lead to disordered eating. In the short term, people tend to feel fatigue, nausea, dizziness. People tend to have low fiber intake. So what I would recommend is anytime you're looking for a weight loss diet, the gold standard really is to reduce calories. The typical treatment for overweight or obesity is to reduce calories by 20 to 30%. And this is bad news. Nobody wants to hear this, but that's usually for life. It's not usually just for that weight loss period. Usually you have to maintain that. So you want to find a diet that you can really follow long term. And then you really want to pay attention to how you feel. If you're feeling dizzy and nauseous and tired, it's probably a sign that it's not a healthy diet for you. So I would always be more concerned about what you're eating and how much, as opposed to what time you're eating it or cutting out large food groups.